Professor Carl Heneghan, we'll move on to him because he's all right.
He'll have noticed.
He'll have noticed. Professor Carl Heneghan was one of the most vocal critics of the government's lockdown policy during the pandemic.
Yes, and the Professor for Evidence-Based Medicine at Oxford University is also a practicing GP. He faced plenty of abuse as a result.
Yeah, he got a taste of some of the abuse this week that he had faced at the COVID inquiry, and Carl Heneghan joins us now. So, Carl, when you went into the inquiry, obviously all prepared, yes, you're a Professor of Evidence-Based Medicine, NHS doctor for 23 years, qualified GP, and an NHS honorary academic. So lots in your CV there. Were you expecting the tone with which the questions were aimed at you and the questions that were asked of you?
No, not at all. I sometimes in life you get ambushed, and that's what happened. Minutes before we went in, they produced other documents and said, this is where we're going to go. We're going to ask you about these issues. I'd prepared a full statement, which we was going to talk about things like the care homes. And I am one of the only people, I think, who has experience, like you said, of going into care homes and can look at the evidence. All of that was not talked about. And what happened is it seemed to be a discussion about my credibility, trying to undermine me. And this is from outside. I'm getting huge amount of messages from people saying, actually, I was treated very differently to other people. And in doing so, I've come out of the meeting, and I don't think we got to a point where we tried to learn lessons. What's happened here, it was almost an attempt to dismiss me and undermine my credibility in a way that actually doesn't help us learn the lessons of the coronavirus pandemic.
I mean, many people say that when they draw a contrast between the way that they interrogated you and the sort of a bit softer approach to Professor John Edmonds, the SAGE modeller. I mean, did you leave there thinking that you've now got a fair idea of what the conclusions of this inquiry is going to be, or do you think that they were just asking, challenging questions because that's what they're there to do?
Look, I have no problem with being asked difficult questions and being in a situation where it's adversarial. I've given expert evidence in legal cases, and I'm well aware of what happened. But when you take a specific line, what's happening now is from outside, everybody's now looking and coming to me and saying, this inquiry has an agenda. It seems to have already made its mind up. I'm the only person who seems to be speaking from the other side. There are many more other witnesses who could come forward and speak and give oral evidence, but they've all been sidelined. And in doing so, what it looks like is they've come to conclusions and then they have an agenda. And in that agenda, it sidelines certain people or ideas. And I say this is crucial because it's supposed to be an independent inquiry that there's to learn lessons. I think we need to get the diaries, get the WhatsApp messages, get them all published and get those issues out of the way because it's like gotcha moments, it's sleaze, and get back to the important issues. What can we do in care homes? What can we learn in care homes? And when people are insulting and denigrating people, they're just unprofessional. And in doing that, this sort of language, the way they're operating, is unacceptable.
Carl, Professor Edmonds said that he thought if the lockdown should have started earlier, and I think I'm right in saying he said that it might have saved 20 to 25,000 more lives if the lockdown had happened as early as he'd recommended. What did you make of that evidence? And I mean, did he have in mind a particular country that he thought had got it right?
I think, look, there's a history here of getting it wrong with the modelers, and Edmonds was on about the Omicron wave. He got it wrong then, he got it wrong in the beginning. When you talk about this 25,000 deaths, what you should do is go and get a control environment like Sweden and say, well, look, what happened there? They didn't lock down. And actually in the winter of 2021, in that period, they didn't have the same excess deaths as we did. Now, what's happened here is it's very easy to go in an environment and say, we should have done this is what would happen. But it undermines what really was happening is the huge number of excess deaths that were occurring in the home, the problems that were in care homes, and the big problems with hospital-acquired infections. That's what I wanted to talk about and bring my experience and expertise to the inquiry, whereas mathematicians know very little or anything about these issues. The question is, why did the inquiry not want to know about these issues and discuss them and sideline them and give other people a really easy ride and say, well, let's go into all the points where you made errors first and try and understand how we're supposed to trust you if you've got a track record of getting it wrong.
Professor Carl Heneghan, thank you very much indeed for joining us today. Do you know what? I was wanting that inquiry to go ahead. I was hoping we'd learn so much from it, but it has very much focused on the people. Module 1 about preparedness, we heard all about Boris and Carrie. This one here now, they've, tried to sideline him, and they've also tried to, chip away at his credibility, Professor Carl Heneghan, which is wrong.
Yeah, we ought to try and get Professor Edmonds on so we can ask him maybe some of the questions that maybe he wasn't asked at the inquiry.